So maybe Meredith, maybe in a minute or so, Doug should begin.
Yeah. If you want, we can start now.
I think we should because we've got a busy program.
Okay. So we're gonna get started right on time. My name's Meredith Nicholson. I'm a research coordinator at GMHC. Thank you all so much for coming to our second annual HIV and Aging Awareness Day webinar. I am very excited. We have a great program for you today. And so just to give you another overview of the schedule, if you would like to see it. It's what we have going on. And we will get started with opening remarks with Doug Hill, who's the Senior Director of NCHRA Centers at GMHC, and then Dr. Steve Karpiak.
Good afternoon, everyone. Again, my name is Douglas Hill, Senior Director of the NCHRA Centers at GMHC. I want to thank everyone and say how honored I am to be here with you all today. And welcome to the second annual national webinar on HIV and aging. We are excited to present and host an awesome team of speakers and panelists to share their knowledge and experiences that we have all gathered, that they've gathered, as we enter a new decade of this pandemic. And with an aging society impacted by HIV and AIDS, this work is more important than ever. So thank you to all our experts, partners, and participants who have helped to make this work and this webinar possible for you all today. Thank you.
Wonderful. Thank you so much, Doug. And now we will move on to Dr. Steve Karpiak, the Senior Director of Applied and Translational Research at GMHC, and he will give us a short introduction.
Thanks, Doug, and thank you, Meredith. Good morning and afternoon, depending on what coast you're on. Welcome to this second annual national webinar sponsored by the National HIV and Aging Resource Center. We are entering the 40th year of the HIV/AIDS epidemic. Older adults dominate the HIV/AIDS epidemic in the USA and North America. By 2030, 8 years from now, 70%, 70, of all people living with HIV/AIDS will be age 50 and older. As a research scientist, I have spent the last 20 years studying the older adult and the impact of HIV on aging. We know that HIV is not the sole cause of those conditions associated with aging. HIV does not cause cancer or cardiovascular disease, arthritis, kidney disease, glaucoma, frailty, etc. It can, in some instances, increase the risk for those age-associated disorders and the severity of those conditions associated with aging. Older adults are experiencing a higher frequency of multimorbidity of these age-related illnesses. Most of the causes for these disorders occur before one enters the 5th, 6th, 7th, and 8th decades of life. Smoking, poor diet, addictions, badly managed mental health account for high rates of depression, PTSD, and addictions, lack of exercise, homophobia, poor diet, poverty, racism, sexism, and the continued power of stigma and its associated social isolation. These are all contributors ultimately to these age-associated illnesses. The issue of care now emerges as the focal concern for older adults with HIV. Managing viral loads is the critical backbone of care, but new models of care are needed. Models that reflect geriatric care principles, which embrace clinical management that effectively address multimorbidity, associated polypharmacy, cognitive function, and the importance of supportive integrated care, and the power of social networks. The goals are not to cure any condition, but to provide a level of functioning that allows for independence and a better quality of life for those with HIV/AIDS as they age. Part of this process will include AIDS service organizations, obviously hospitals and clinicians, CBOs. Everyone must be part of this delivery system. Listen to today's speakers, which include older adults with HIV. Their voices should be heard, in fact, must be heard, since they should shape how care is delivered to this aging population. The power of activists' voices will best impact the hearts and minds of those who configure our healthcare delivery system. The impact of COVID on these older adults showed us that they are not as resilient as we had thought. They need support and care to live long lives that have a better quality of life than that which they experience now. It is not how long one lives, but the quality of life that one experiences.
Thank you so much, Dr.
So
Carp. Oh, sorry.
okay, I'm good. So I would like to introduce